Roux gastric bypass is a classical operation that is done more than 50 years, and we know long-term results, and this is a procedure that is working really well for most of the patients. The classical Roux gastric bypass is done by the technique that we create a small stomach that is about 20 to 30 milliliters in size, and this small stomach we connect to the small bowel, and then below this connection, about 1 meter below, we make another connection between small bowel and small bowel. Why we create construction like this? Because we create two ways. One way for a food to pass down, that is, the food is coming through the esophagus, small stomach, and coming down in the bowel. And the other way that we create is for digestive juice, because digestive juice is in duodenum, and we have to create another connection between small bowel and small bowel to allow digestive juice to connect to the food. So if you can imagine that we do two ways. One way the food is coming, and the other way the digestive juice is coming, and then only at the lower connection they start mixing. So what effect we get from this? We get the effect that part of the small bowel is not participating in digestive process and less uptake of the food. Also, the effects of gastric bypass are pretty well known on the gut hormones, and we know that after gastric bypass, hunger hormone is decreased and satiety hormones are increased. So generally the patients eat less, but they experience also less hunger, and the uptake of the food is also decreased, but not at the level of so-called malabsorptive procedures, where we can have some problems with protein uptake. After gastric bypass, we do not see these problems. So this is a pretty balanced operation. The advantage of the gastric bypass also that the patients after operation cannot eat concentrated fat and concentrated carbohydrates or sugars, because they can get a dumping syndrome, a discomfort, their weakness, and they try to avoid all this. The disadvantages of gastric bypass are that after this operation, you need to take vitamins and microelements like calcium and iron rest of the life. But also the same should be done also after a sleeve gastrectomy.